Ongoing concerns from our pandemic, they were among the top stories of 2021, and they're continuing to spill over into 2022. So how long will we be dealing with COVID-19 this year? Joining us on Zoom to explain where we stand and what to expect in our year ahead is Dr. Kelsey Graves with the University of Utah Health. Doctor, thanks for joining us here this morning. It seems like this virus is just not going to quit.
Good morning. Thank you for having me. Man, that's a hard question, is to predict where we're going. So I'm going to start by just saying what we have seen in other states. And so Utah has peaked a little bit later than many of our states back east, and so that's by a few weeks. We have seen other states surge to about fivefold what they saw in our peak last year. Here in Utah, we're about threefold. I think we have not yet peaked, and I think we've got several weeks left of high coronavirus transmission in our community.
So what does that mean in the end right there? How long do you think this is going to, the surge that we're seeing now, how long do you think that's going to disrupt life here in Salt Lake?
Yeah, I think the one thing I'll say is I know we're all tired of coronavirus disrupting life, right? What we need help with now is slowing the spread and minimizing the impact on our hospitals. And so that can be getting boosted, getting vaccinated. Those are all really important things still 2 years into this. Most people model that this will start to drop by the end of January, mid-February. I think it's important to note, though, that hospitalizations and deaths follow case peaks. And so as far as the impact on our healthcare system, I would estimate personally that that will surge through February.
So the surge itself will come to a relatively brief end next month. At least that's what you're hoping for. As far as the pandemic in total, do you think it will end in this calendar year?
Yeah. I sure hope, as I'm sure we all do. Most pandemics last a couple of years. And so I think my personal opinion is that coronavirus will be with us from now through the future. The 1918 flu pandemic virus is still with us. My hope is that it will not cripple us like it has for the last 2 years. The keys are trying to protect ourselves from being admitted to the hospital and protect ourselves from serious illness and from death. And so again, that's boosters, those vaccinations, but my hope is that we will end this in the next year. But again, I'm no fortune teller.
So it sounds like, is this something that we will just have to learn to live with?
I do think we'll see coronavirus circulate through the world indefinitely. Like I said, there's many other pandemics that do that. We have tools that can protect us, and those are important to remember. So if you've not been vaccinated, this is a really great time to do that. The Omicron variant is more transmissible than anything we have seen. Booster does matter. It helps reduce symptomatic illness, helps keep people out of the hospital. And so if we're going to live with coronavirus, which I do think is true, I think it's important to take those steps to protect ourselves.
So what do you think is going to be the shift in difference that if this is going to continue indefinitely? Right now we're doing mask mandates, we're having remote learning. When does that portion of our pandemic end if the virus will continue?
That's a really good question, and I think it depends on what the virus does. So what COVID has shown us is that it will mutate to try to find a vulnerable source. And that has looked different over the last several years. So what happens with the future with viruses? So I can talk about 1918, which is what happened. In the 1918 flu pandemic, either everyone was infected or people died. And that's a really hard way to reach herd immunity, right? Is the impact on that is devastating to our communities, to our families, things like that. Will this virus change to be less virulent? I don't know that. I think that there are multiple layers we can use to help protect us. Masks are one, vaccines are one. Right now, those matter to not overwhelm our essential services like stores, schools, hospitals that you've mentioned. What will things look like in the future? I don't know that. I can remain hopeful that the pandemic will wind down and be less of an impact.
Well, that's the million-dollar question we're all hoping to be able to find an answer to relatively soon. Dr. Kelsey Graves there with the University of Utah Health, thanks for talking with us here today.
Thanks for having me.
Of course, you can find that interview online at abc4.com with all the other information for our pandemic at abc4.com/GMU.